So hi, I'm Jordan Meredith. I'm a physical rehabilitation student. So I'm here today to teach you about breathing exercises. And this is going to help you get more air inside your lungs, and it's going to also to help you clear the secretions that are stuck inside your lungs.
Okay.
Because I know that you have a lot of trouble getting rid of your secretions and coughing. So, how are you doing today?
I'm fine. I'm good. Yes.
I'm good.
I'm good.
You have a lot of pain still at your ribs?
It depends.
Depends. When you move, do you have pain?
A little bit.
A little
yes.
bit?
Yes.
So today I'm just going to show you breathing techniques. Okay. So the first technique that I'm going to show you is called diaphragmatic breathing. So this technique is used to help you get more air inside your lungs, and it's going to help you. It's going to help you decrease your work of breathing. So you're going to have less difficulty breathing. Okay. So so I'm just going to position you in a more comfortable position. So
Okay.
so like this. Yeah. So you're going to be in this. You're going to be like semi-sitting. So you're going to have your back a little bit tilted,
Okay.
like this. So I'm just going to take off the drapes, just so that you can have your yeah. Yes, just a little. Yeah. Perfect. I'm just going to decrease it a little bit more. It's a little bit too high. It should be just perfect, like this. Are you comfortable in this position?
Yes. Yes.
Okay. So to do this to do this breathing technique, at first you need to relax your shoulders, your neck. So first of all, do you know what is the diaphragm muscle?
No.
So this muscle is just below your rib cage. So it's right here. This muscle is responsible for your breathing. So when you breathe in, so breathe in, take a deep breath. It's going to go down, and when you breathe out, it's going to go back up. So it's really responsible for allowing you to get more more air inside your lungs. So this is one of the major muscles of breathing. Okay.
Okay.
So when doing this exercise, I'm just going to place one hand on your stomach.
Okay.
Like this. So I want you to take a deep breath in through the nose and breathe out through the mouth. So deep breath. Try to lift my hand, as much as you can, and go back down, and so you really need to inflate your stomach and rise my hand. So take a deep breath in again through the nose and through the mouth. Go back down. Try to get rid of all the air in. Yeah. Okay, good. So you can take a break. So make sure when you breathe that you don't use that your shoulders are relaxed, that you're really relaxed. Because if you're tense, this exercise is not going to work. Okay. So we really want to concentrate on the diaphragm muscle. So I want you to put your hands on your stomach. So I want you this is going to provide you feedback on your exercise.
Okay.
So I want you to do it five times. Again. So take a deep breath through the nose, the most that you can. Inflate the stomach. Yeah. Good. 1. Right. So it's normal that at the end that you feel pain a little bit at your ribs. Okay, it's normal. Try to get all the air out. Yeah, try to inflate all the air and go back down. Okay. So you can take a break. So when you're going to do it by your own, I want you to do 5 times. Take a small break, a 2-minute break, and do it again 5 more times. So you should be doing it a total of 10 times. Okay, and I want you to do it twice per day. So 10 times in the morning and 10 times in the afternoon. Okay.
Okay. Yes.
So that's the first exercise. So when you did it, did you feel that you could inflate more the lungs?
Yes.
That you had, it was easier to breathe?
Yeah. Yes.
Okay, that's good. Make sure when you're doing it that if you feel dizziness or you feel shortness of breath when doing it, that you stop, okay? We don't want to aggravate the symptoms of your breathing. So that's the first exercise. The second exercise is called active cycles of breathing.
Okay.
So first, before showing you this technique, I want you to show you how to cough. Because I know when you cough, you're having pain at your injury, at your ribs.
Mm-hmm.
And that's why you said that when we were asking the questions before that it was preventing you from coughing. So I'm going to show you a huffing technique. So to do this technique, it's good. It's similar to coughing, but there's less pressure required to do this technique. So it's going to cause you less pain when doing it.
Okay.
So to do this technique, you're going to, as like coughing, you're going to take a deep breath in. So through the mouth. So to do this technique, it's like if you were steaming up a mirror in front of you. So you take a deep breath in. Like this. So as you can see, it's different than coughing. Because coughing, it's like, and there's more pressure required. So this technique is really beneficial for you. So we'll try doing it. So take a deep breath through the mouth. Yeah, perfect. You can put your hand in front of you, just and if there's Kleenexes just beside you, so if you need to expel secretions, there's just Kleenexes there. So when huffing, there's two huffing techniques. There's one that you take a deep breath in, like this, like. So this one is louder and it's shorter, and this is good to bring the secretions that are closer to your throat. Okay, sorry. And the other one, it's a medium breath in. It's when you breathe. So you take a medium breath. Okay, so I'll redo it. As you can see, this one is quieter than the first one, and it's slower. So this one is going to bring the secretions that are further away from your lungs. So when doing the huffing technique, I always want you to start with a medium breath in, and after the second huff, I want you to do it with taking a deep breath in. Okay, so we'll try again. So start with the medium breath in. Yeah, perfect. We do it again and try to prolong like the air. So do it again. Yeah, perfect. That's the medium one. Okay. So now you bring the secretions that are furthest away closer, and now we're going to do the deep breath in to bring the secretions that are close to your lungs out. Okay, so take a deep breath in and do the same thing. Yeah, good. Just try to do it again, but take a deeper breath. Do it again. Just try to take your time bringing the air inside your lungs, okay?
Okay.
Yeah, that's good. Okay, so that's the huffing technique. And when doing it, did you have pain a little bit at your ribs?
No.
No? Well, when doing it, just in case, because the more you're going to do it, maybe it's going to cause you pain. I want you to put this pillow. It's going to provide you like you're going to provide pressure on the pillow.
Okay.
And so you're going to provide pressure on the ribs. Okay. So yeah. So I want you to. So when you're going to cough, and like do the huffing technique, you're going to provide pressure, and it's going to cause you less pain. Because when the major mechanism why you have pain when you cough is because there's the pressure buildup, and it's causing you to have pain. But if you press on it, it's going to decrease the pain. So let's try. So do the huffing technique. Yeah. So make sure that you provide pressure. Did you feel a difference, or there's no pain at all?
There's no pain.
No pain. Okay. So when you can use this if you have pain. Okay.
Okay.
So if you're starting to have pain, put the pillow, and you can do this technique. So now, yeah. So I'm just going to take up this here. So now you know how to cough to clear out the secretions. But I'm going to show you a breathing technique that's going it's even better. So for this, you're going to start with normal breathing. So the first step is just breathing normally. You can put your hands. It's similar to on your stomach, and I want you to lift the stomach. It's similar to diaphragmatic breathing, but I want just you to breathe normally. No deep breath. So take a small, yeah. Just breathe normally. So just take a few breaths, normal breaths. After this, you're going to put your hands on the lower ribs, okay, on the side, just a little bit, yeah, like this. So I want you to take. You're going to take 4 deep breaths, trying to expand the ribs, okay.
Okay.
So take a deep breath through the nose. Try to inspire as much as possible and hold for 3 seconds. 1, 2, 3, and release. Good. So we'll do it 4 times. Another time. Yeah. Hold 1, 2, 3, and release. Good. Okay, one last time. Okay, so now, you can bring your hands down to your stomach again, and now just breathe normally. Yeah, breathe normally. A couple of breaths. If you feel dizzy anytime when doing this exercise, stop. Okay, and so you're going to take a normal breath, and after you can do the huffing technique that I showed you. Okay, so do you want to use the pillow? Yeah, so use the pillow. Okay, so now do the medium breath that I showed you before. Start with the medium. Yeah, it's longer, quieter. Okay, now take a normal breath again, and now do the deep breath. Yeah, good. That's normal. That sometimes when you do the deep breath, you have less control over it. So you're going to do two huffs, and after you're going to go back to your normal breathing. Okay. So that's one cycle. So again, put your hands on your stomach. We'll do a normal breath. Okay, after the normal breath, when you feel that you're relaxed, you're going to put your hands, again we'll do deep breaths, 4 deep breaths. Take your time. Okay. 1, 2, 3, make sure to hold 3 seconds. 1, 2, 3. Release. 1, 2, 3. Okay. And release. Okay. and after that it's the huffing techniques. So you're going to do huff. So you can do it. Yeah. But just take more time to bring the air in, okay? Because sometimes when you're doing it, you're not taking the time to bring the air all inside your lungs. So because we're doing this, you try to take more time. Okay, it's a medium breath, but you can take your time. So okay, so do it again. Do the medium breath. Yeah. Okay. Now you bring the secretions up, and now we'll do the deep breath. Yeah. Now you bring even more closer to your. Do you need to cough up secretions? There's no.
No.
Okay. So that's you're going to do this technique 5 times. So you're going to do the cycle 5 times. So you're going to do So you're going to start with normal breathing. Take 4 deep breaths. Do the two huffs. That's one cycle. So, and you're going to redo this cycle 5 times. And after you're going to take a 5-minute break and do it again 5 times. So you're going to do it a total of 10 times. I want you, the same thing as the diaphragmatic breathing, you're going to do it two times per day. Okay, so 10 times in the morning, 10 times in the afternoon. So that, and this, this exercise is good because when you take a deep breath, the deep breaths that you're taking, it's going to allow air to get behind the secretions. So all the air is going behind the secretions, and when you do the huffing technique, it's very beneficial because it's like a vacuum. It brings the secretions, it pushes the secretion out of your lungs, and this is why this technique is really good. Okay, so try to do this one, and try to do the two exercises. So the first one, it's called what?
Diaphragmatic breathing.
Yeah, and the second one?
Huffing technique.
Well, it's active cycles of breathing, which is combined with the huffing technique. Okay, and make sure that you use your pillow to provide pressure. If you have pain, you should do it always with the pillow. Okay, when you're doing the huffing. So that's all for today. Do you have any questions?
No.
Okay. So I'll see you. We'll continue. I'll see you in a couple of days, and so try doing these exercises. And so thank you very much for your time.
Thank you.
Okay. Bye.
Bye.